Good morning, Sioux Falls. I'm Joe Kippley, Public Health Director for the City of Sioux Falls, and it's an exciting day here for the Health Department and the community's health. We are unveiling our 2025 Community Health Assessment in partnership with friends at Avera, Sanford, the Sioux Falls VA, and the City of Sioux Falls Health Department with our Public Health Clinic, Falls Community Health. So you'll be hearing from myself and some colleagues that helped put this report together. This is a report we do every 3 years. So some things change over 3 years and some things are pretty static, but we can always be working to improve our community. So alongside our healthcare partners, it's this report that we're publishing. We've got two different versions for people. There's the 100-page book version, and there's the one-pager. You always got to have a one-pager for some reason. So we've got a good summary, and we'll kind of give the highlights, but we'll obviously willing to take some questions as we go. But mainly, I come to you today with a spirit of gratitude. This is just such a lovely community to live in, and the healthy living that we all aspire to, but it comes with intentional effort of partnerships. So while this is a holistic report, looking at it a lot of different things, I want to talk a little bit about the holistic partnerships that go into it. We're lucky to have a health system like Sanford Health survey some of our residents, our friends at Avera doing some focus groups, and then our city staff looking at a lot of secondary data sources, whether it's a CDC website or census data, South Dakota Department of Health data. So a lot of variables went into this to cook this recipe up into a 100-page report. So it definitely takes an immense team effort across our healthcare community, and hopefully it kicks off to an even bigger collaborative effort that we'll kind of talk about as next steps, what comes out of such a report. But the top three things that come out and are conveniently highlighted on our one-pager would be, as we look at the priorities of the community, we look at things like healthy living. You know, what can we do to encourage healthy behaviors, the social determinants of health that make each of our residents more healthy? Chronic disease prevention, obesity, high blood pressure, all of those things that drive up costs in our health system. A second priority, we knew we had to cover some aspect of mental health in our community, but we wanted to focus in on a specific area. So we'll be talking a lot in the next 3 years about adolescent mental health. So more to come on that topic. And our third priority area is access to care. So access to the facilities that you'll be hearing from, like Avera, Sanford, and VA facilities, but also to other services like especially oral health, so dentists in our community. How can we strengthen those efforts, whether it's private sector dentists, and then also at the city we run a dental clinic. So those are some of the highlights, but I want you to hear from some of the co-authors of this report. This is not a one-person effort. So I'm going to first invite Dr. Ron Place from the CEO of Avera, McKennan, up to this podium to give some remarks from the Avera perspective. Thanks, Dr. Place.
Thanks, Joe. Well, good morning, everyone. As Joe mentioned, I think it's really important to highlight how collaborative this was. All of us had a piece of it. All of us had responsibilities. In fact, we agreed what those responsibilities were so that collectively we could achieve this report that you see in front of us. One of the things that Joe mentioned, though, was our responsibility to do focus groups. If you remember what was written in the 2022 to 2024 assessment, there was some perhaps unsurveyed or unacknowledged members of our community that just weren't part of the survey process. And so we were asked to do or focus groups to get to some of those unrepresented parts of our community, those who have really challenging access to health care, those who don't understand our system, those who have challenges from a socioeconomic perspective, even being available for telephone surveys or even in-person surveys, that sort of thing. So we used our community health workers as the model to get out into the community and then do focus groups and get the same sorts of data, the same sorts of information that we would normally get from a phone survey or things like that, but out into the community. And we learned some things, probably learn some things on how we're going to do it better next time as well, but it's through this sense of collaboration, using multiple different techniques to get the information. We think that the data that you're seeing this year is a little bit more robust than the data that we've seen before. A couple of things that we saw in particular from an Avera side that we find impactful, as Joe mentioned, behavioral health. access to mental health services in this community, and in particular access to mental health from a adolescent perspective and all the challenges that come with being an adolescent and everybody telling you what to do and all the very strict requirements of where you must be at all times and the requirement for education all pointed together. So we take that very seriously at Avera. We have a long history here in Sioux Falls of being a significant provider of behavioral health services. In fact, we've recently finished the last of our shell space in our behavioral health center, so now it's as big as it can possibly be without doing something significantly different, and we're very appreciative of all the input from the community and foundation organizations that have helped to build that. But being an adolescent and having challenges continues to be a problem for some. And so we're using things like partial hospitalization, which enables someone to continue to go to school and still receive the same sorts of therapy that comes from a hospitalization, or intensive outpatient to go along with routine clinic visits, that sort of thing. So the flexibility to be somewhere in that care continuum to meet these adolescents where they are. Now, if you look at the next steps to that, well, what else can you do? And one of the things that we've tried to do with some success is our nationally, even internationally recognized Ask the Question campaign. Can we provide the tools, provide the resources to people, adolescents, adults, children, anyone, so that they understand what are some of the challenges that are happening to them, can they make sense of it, and can we prevent suicidal behavior? And then with partnership with the Sioux Falls School District, the Bishop O'Gorman school system, all of that together, can we make a difference? Now, still a lot more work to go, and we recognize that. And a lot of that's detailed in the report. As you read the 100-page one, not the one-pager, there's a whole lot more details on what that looks like. Joe also mentioned, sort of the socioeconomic challenges of our community. And another area I'd like to highlight is food insecurity. It's a challenge for many people in our community. And it may not seem like it to most of us because we don't have it, but yet there's a significant percentage of the population that does have that. So partnering with Feeding South Dakota as a mobile food pantry to get food where people need it. We're in the first stages, and by first I mean truly weeks, the first stages of doing an assessment within our OB and PEDS clinic to see where are people and where is there security or not in food. And is there a way for us to provide it for those in the greatest need, to provide some sort of a bridge of food until they can get to some sort of sustainable food system. So those are just a couple of different ways. We can talk about lots of things that are in that report, but those are the things I wanted to highlight. It's my pleasure really to now introduce my colleague in all this from Sanford Health, Andy Munce.
Thanks, Dr. Place. Appreciate the opportunity to be here this morning. My name is Andy Munce. As Dr. Place said, I'm the interim president and CEO of Sanford Sioux Falls region. As you'll hear, you heard from Joe, you heard from Dr. Place, you'll continue to hear really the spirit of this is collaboration. And I think we can be proud not only as contributors to this report from a healthcare perspective, but also as citizens of Sioux Falls and how we're addressing a lot of these needs. So I think it's something to be really proud of as a community. The community health assessment is an important piece of these partnerships as we can continue to interact and hear from all sectors of the community. As Dr. Place said, one of the enhancements was our focus groups, so we could make sure and ensure that we're reaching more people and getting more feedback as we really approach and refine this report. We're proud to work with the city, obviously our other healthcare partners on this project, to not only advance the care of those in the community, but also hear from as many residents as possible. So especially those that are underserved, we want to make sure they have a voice in this process. A few stats on the survey, and I don't want to talk about all of them because I know you hear more about them, but as an attempt to enhance the broadness of this reach, the survey was offered in 4 languages, so that's an improvement, and it was promoted online through multiple channels in addition to the focus groups that Dr. Place spoke about. In total, there were over 1,100 individuals in this community that shared their experiences and concerns with us, and they were a direct input into the action plans associated with the health assessment. The CHNA reinforces our focus to decrease falls in the community, increase behavioral health access that I'm sure you'll continue to hear more about, whether that be in person or through new programs through virtual care, or really the intent is to meet people where they're at and make it easy for them to receive that care. The latest CHNA builds on a lot of programs that we've implemented over the last few years at Sanford Health. An example of one would be Sanford Helps. That was launched in April 22. What that is it's a website that really allows and connects patients to some of the social care community resources that we know people are lacking. So is that financial support? Is it food support? Is it medical care, housing? You name it. But those are free or reduced cost resources that we connect people to. And with that, we actually translate that information into 100 languages. So that's very diverse. And then that information can get sent to the patient, resident, however you want to define it, via email or text message. There's consistent evidence on how social determinants do impact and shape a person's health. So obviously being in the healthcare industry, we're very focused on that in ways that we can continue to advance really the programs and increase options for these patients. And one of the exciting partnerships that we have at Sanford Health is with Feeding South Dakota. Right now within our kids, we have within our Sanford Children's Castle, we have a small but stocked room of food called the Kids Kitchen. And really what it is it's a food pantry. And what we're seeing through there is pretty eye-opening. We screen all of our patients that come through the castle and their families to look for food insecurity. And what we're seeing is 20% of our patients and their families do identify as being food insecure. So every week, we hand out 3/4 of a ton of food out of the front doors of the castle to family in need. And we serve about 1,000 families a month coming in to the Kids Kitchen. We do have plans to expand that, so we'll have a second location, and it'll be really focusing on some of our women's services as well. So really looking forward to expand that. Imagine families going through a difficult situation or a crisis with a child. Last thing they need to do is worry about food, and we feel like we're making a big difference being able to help provide them 4 or 5 meals every time they come in to our castle. So we're grateful for that partnership, looking forward to expand it, and really open to any questions about that afterwards. So next, I'd like to introduce Dr. Pendergrass with the VA. Yep.
Thank you, Mr. Munce. On behalf of Ms. Ackert, the Medical Center Director, and all of the staff of the Sioux Falls VA Healthcare System, good morning. The Community Health Assessment is a distinctly important tool and a vital resource for understanding the health and well-being of the Sioux Falls community and the related community needs and resources. The veteran population that we serve, while similar to the general population, also has numerous specific health challenges and needs. In addition to the common acute and care conditions, veterans may have unique concerns, challenges to their overall well-being, and healthcare needs from their service-related experiences and exposures. The Sioux Falls VA Healthcare System is committed to providing the highest quality care to our veterans, and we do offer many veteran-focused programs and modalities that are developed to treat and support these veteran-specific needs, as well as the traditional healthcare model. The VA prioritizes healthy living, emphasized through what we call the whole health concept. This approach empowers veterans to take charge of their health by focusing on their physical, their emotional, and their mental well-being as a whole. Through this concept, the VA helps to provide resources and support to encourage healthy lifestyle changes that can lead to overall improved healthcare outcomes. And in doing that, our partnership with the community, with the resources that are laid out in the community healthcare assessment, is vital to establishing that overall environment for the veteran. The resources that we have in our facility include the Integrative Health Clinic, tobacco use treatment, what we call the MOVE program for weight loss, as well as a lot of traditional chronic disease prevention and disease management programs. The VHA particularly understands the importance of mental health for our veterans and the community. Our mental health team within our facility offers a range of programs to support veterans facing suicide risk, PTSD, depression, and other mental health concerns. And to enhance these efforts, we collaborate extensively with the City of Sioux Falls, with our local healthcare network community providers, and with volunteer organizations and service organizations to create a strong support network that promotes mental well-being and ensures that veterans, wherever they are, receive the care they need. This integration is particularly close in the area of suicide prevention, where we work very closely with those community resources.
One notable VA program that I would like to highlight in this area is called the VA SAFE program, SAFE, which helps share and spread skills for the community, not just for community providers, but for the community at large, to help identify veterans who might be in crisis and to help provide them the support they need and get them to the treatment they need. And if you want more information about that, I'd encourage you to Google that. The VA has quite a lot of web-based information about that helps you get into that program if you're interested in learning about it. We continuously strengthen our community outreach initiatives, collaborating very closely with the City of Sioux Falls and with our local healthcare network providers. By remaining adaptable and responsive to these needs, the VA continues to have a meaningful impact, ensuring that the health and well-being of veterans remains a top priority, not just for us, but for our entire community. We look forward to continuing our strong partnerships with the city and with our healthcare partners in developing further comprehensive solutions to address these many challenges. One that has been mentioned here that we, I think, are a little bit uniquely positioned to support as a healthcare organization is homelessness in the veteran population. We have a specific program, the HUD-VASH program, where we can help identify homeless veterans and support them with housing needs. I would like to welcome Dr. Jennifer Tinguely, the Chief Medical Officer for the City of Sioux Falls.
Thank you. All right. Good morning. Thank you for being here. I did have some slides that we were going to use, but we're having technical difficulties. So my lecture piece of showing you statistics and tables, I will have to just give you numbers. They are all in the report that you have. But like I said, my name is Jen Tinguely. I am the Chief Medical Officer at Falls Community Health. I'm a family practice provider, and I see patients there at the clinic. I've been there for about 12 years, and also work as the medical director and work with the city, and very fortunate to work with Joe and our entire team in the health department. So for those that aren't aware, Falls Community Health is a federally qualified health center, or FQHC. We are funded through the federal government, through HRSA, and so a large bulk of our budget comes from the federal government, and we are here to serve as a safety net provider for anybody in our area that may need help that maybe does not have insurance. So we have been very fortunate over the last couple of years to see the number of uninsured patients in our clinic start to drop. And I think that's credit to Medicaid expansion. We've got very dedicated staff working to get people enrolled in the Affordable Care Act, and happy to see those numbers drop. But also very important to know that there is a place for people to go to get their primary care needs met at our clinic just up the street. We're a unique clinic in that we do provide primary care, but we also have a lot of other services. So we have a dental clinic located in our building. We provide mental health treatment. We provide substance use treatment as well. We're very fortunate to have all of those services that we have located right in our building. So a lot of what you'll see in that health needs assessment is definitely not news to those of us that are working as a safety net provider, and honestly anybody, whether you're working in a private practice at Sanford or Avera or at the VA, these issues are not a surprise to us. We know that chronic disease is something that affects anybody and everybody, but here in Sioux Falls, in our MSA, we do have a very high percentage of our residents living with obesity. And our statistic here, it's 37% of adults in the Sioux Falls MSA do qualify as being obese. This is higher than the state and the national average, so it is a concern for the residents here who may be dealing with some weight concerns, which then usually comes with things like diabetes and hypertension. We have seen improvement in the number of patients living with diabetes and high blood pressure, hypertension. But overall, if you look at the last decade, those trends are moving upwards. So it's nice to see a drop from the last time we did this report, but obviously something we still need to continue to work on in our community. One of the other areas of very important concern of mine and the patients that I serve is the number of people living with substance use disorders. And one of the areas that I want to highlight are those patients struggling with alcohol use and abuse. 1/3 of all driving deaths in our MSA are related to alcohol. If you look at the table in the report, it is a very sharp upward trend of the number of deaths related to alcohol. We just received word, an advisory that was released January of 2025, so just last month, this was from the Surgeon General's office, that frequent or regular alcohol use is related to a number of different cancers. So I think people often feel like, yeah, liver cancer, that makes sense. Somebody that's heavy drinking, they are going to have a higher rate of, or a higher risk of developing liver cancer. But there are many other cancers, including breast cancer, throat, larynx, esophagus, just kind of anything up in this area. We do see a very tight correlation between heavy alcohol use, and sometimes it doesn't even have to be heavy alcohol use. So this is something that we need to continue to spread the word on and continue to work with our patients on, and we need to screen for those. I definitely see the impacts of alcohol in my patient population. I take a very strong interest in treating substance use disorders, whether it's alcohol, methamphetamine, or opioid use. And I can tell you that the number of patients that are using alcohol, it's quite high. And whether they may not even screen out as having heavy use, it does impact a person's blood pressure. It does impact their liver function, even if they're just drinking it on the weekends. So just want to kind of call that out and recognize that this is something that our community needs to work on. We talked about mental health. I don't think you can work in any clinic across this town and not recognize the need to talk about depression, anxiety, and maybe trauma that a patient has went through. We are going to focus this year or these next few years on adolescent mental health, but I think, we've got to be able to talk about everybody's mental health. And so it's wonderful to see programs, Avera and Sanford, the VA for sure, working with all of their patients on this issue that impacts just so many people. In South Dakota, suicide is the leading cause of death in our young population, so ages 10 through 29. The leading cause of death is somebody taking their own life. That is a particular concern among certain populations. We see a higher rate in our veterans. We definitely see a higher rate in our Native American population. And there have been crises kind of happening across our state. And so I'm really glad that we're bringing to attention this very difficult topic, but it is definitely something we need to talk about more. We talked about access to care being one of our priority issues. Again, we're a safety net provider. We're there to provide care for anybody that might need it, whether they have insurance or not. But one of those areas that's of particular concern and the focus of this report is oral care. It was a startling statistic. 61% of those ages 1 through 20 who have Medicaid or the Children's Health Insurance Program, or CHIP, have not received preventative dental services. So even though they would qualify for it, they're not getting it. And that's a startling thing. We know that a patient that has Medicaid, they often have a hard time finding a dental clinic that will accept that insurance. Again, Falls Community Health is a wonderful place. We do accept Medicaid, and there are a couple other dental clinics in town. But it is of a concern that many people that would seemingly have access are not able to get it or are not aware that they can get it. And then there's that whole bucket of people that don't have insurance, and that lack of oral care will impact them, not just with pain in their mouth, but it actually does impact their chronic disease. So we see patients with diabetes, and their diabetes is hard to control, probably because they've got inflammation in their mouth from untreated dental caries and things like that. So I'm happy that you're here. We're going to definitely want to take some questions from the audience, but I'd like to introduce and have Joe come back to the podium, and we'll wrap this part up.
Yes, thank you, Dr. Tinguely. Definitely grateful to have our partners here. Also want to do a shout out for Dr. Jen Tinguely as our Chief Medical Officer of the city. I think a lot of times we put her pigeonholed as the leader of our Falls Community Health Clinic, but remember, she's the Chief Medical Officer for our city, and so thinking about how this mayor has really prioritized public health along with our fire department and police department as public safety. And so in government, we have some duty of public health and public safety. So I just thank Dr. Tinguely for playing that role for the city and being my right arm as our physician running the health department. So just wanted to wrap up that I think you're getting a sense for how broad this report is, how many different topics we cover, how many different call-outs from some of my colleagues about food insecurity and some nonprofits in the community that are working on that, homelessness programs, Friends of the School District. So all these priorities, it's going to take a coalition of people working together to now make an impact on it. So today is mainly about announcing the report in and of itself, but obviously the next steps on things like access to care, adolescent mental health, and healthy living, it's going to take a team effort. So I'm heartened by the turnout in this crowd today, that there's going to be some stakeholders that are willing to step up and join some committees or working groups or projects. I think some of the categories of priorities we're choosing are broad enough that there's going to be endless possibilities of things that we're going to be able to collaborate on in the next 3 years. But again, thanks to all the partners that helped us issue this report. And I guess just the last kind of housekeeping item is we've got a few copies, I think, running around of the hard copy full report, but otherwise that's the summary page, and the full report itself is on siouxfalls.gov/community-health. So would hope that all residents of the community get a little bit of time to maybe pick out some of their favorite statistics in there, something we could work on together. Any bright ideas, sure, bring them to me. And over the next 3 years, we hope to move the needle so that we're back here 3 years from now, giving another community health assessment and ideally telling a story of some improvement in some key areas. But with that, I think I'd open it up to any questions.
Hi, good morning.
Yeah.
Sandra Melstead, longtime public health professional based here in Sioux Falls. Great to hear all the great work you guys are doing. Just curious if any of you you could speak to how you envision implementing or addressing the issues that come up. And it's certainly from a public health approach. You are all from a clinical approach, and we know really need to see the clinical and the public health collaborate on things, especially with one of your top priorities being social determinants of health. And so wondering if you could enlighten us on kind of what your vision is with that moving forward. Thanks.
Yeah, I can speak to it broadly. I kind of allude to it. I think that there's going to be a coalition of the willing aspect. I think we'll take all comers. I think we've got a few good ideas, maybe to give one aspect, maybe on adolescent mental health. That's something the city is already present in the Sioux Falls School District at the elementary school level. We have 3 clinics in the elementary school level. So how do we build on a good thing? We've got some embrace into the school district, but basically adolescent mental health, I think, is going to be our foothold to how do we get into the middle school and high school age groups. So that's going to be a partnership with the school district. And then obviously the health systems are already doing many great things on mental health. So it's not necessarily throwing out the baby out with the bathwater. I think we're doing a lot of good things, but how do we bring in more partners to do what we're already doing, but better, and extend some of those services to, like adolescent mental health, to a targeted age group. But yeah, this is today mainly is just the assessment, letting us all digest that. But I think it's a very obvious next step question, and it is going to be not just clinicians involved, but other nonprofits, community resources to take a holistic approach to it. But yeah, I kind of use the phrase a coalition of the willing. If you're willing to come to some meetings and work on some things and help us, what are the trade-offs in our community? We have finite resources. We can't be all things to all people, but where we can make improvements, I think all of my partners stand ready and willing to participate.
Can you help contextualize this report at all? Looking at, previous reports of community health assessments, are there any areas where the city has seen improvements or moved the needle in a positive direction? And then conversely, are there any big jumps that stand out to you as like, oh, this got a lot worse?
Yeah, I think in our going through the data, one of the scariest parts of something that got worse and is now getting better, so maybe I'll do a 2-for-1 answer here, but talking about sexually transmitted infections in the community. So syphilis would be something we're very concerned about in the community. We were, I see my friend Jeff Griffin from the chamber here. We talk about, let's wrap that up. I was just thinking about, usually we're talking about how Sioux Falls is number 1 in things. Yes. But that would not be something where we want to advertise that we're number 1 in. So this was something in 2022 we were number 1 in, and we wanted to mitigate that issue. And that's something that's statewide. So we think about where the Secretary of Health was working on that and trying to mitigate sexually transmitted diseases, especially the Native American reservations, and then also in the city of Sioux Falls. And so that's something we often like to be at a podium like this talking about our positive business climate and how we want to attract people to Sioux Falls. But then when you're on #1 on the list for congenital syphilis, and the big concern with syphilis too is that the congenital syphilis, you're passing that on to baby. So pregnant mom to baby, not a good situation. So that's one where I think we saw something get worse, but now some of the data is showing getting better. Another area I think that where we saw some improvement, and this is a collaboration, I'd probably highlight some of my friends at Sanford, especially on this one, is on fall prevention. We got a coalition really coming together across the health systems, and then also the fire department. So think about other city agencies that aren't just the health department, but other agencies that maybe get called in for lift assist. So someone has fallen down in their home or at a business and can't get back up. So that's one where I think we're moving the needle, and we're working hand in hand across health department and fire department on fall prevention. So that kind of falls in our healthy living category, something that's never going to go away altogether, but you can always look for constant improvement. So,
what is your general reaction to this report? I mean, is the city in good shape overall, or is any of this alarming to you? What's your reaction?
well, I think any report like this is always going to have a mixed review, kind of a mixed report card. There's going to be some things that have room for improvement. I think back to the other question too is over prior reports. A lot of this in a 3-year time span, not enough can change to some chronic conditions. So some of those things you're looking for, have we moved the needle on something programmatic or something like sexually transmitted diseases or infectious disease can kind of run hot and cold. But I think the state of our community, I think when we look at it holistically across some of the things we offer for quality of life and healthy living, you know, so that again, I look to some of my other, it's not all about the health director here. Think about Parks and Rec at the city. We have one of the best park systems in the country. We have a bike trail. We have opportunities to exercise. Indoor recreation is something the city is investing in. So in these cold winter months, you can get some exercise, and that helps both physical health and mental health. But I would say, I can say quite definitively, our health community, and I think seen by the audience here today and some of my fellow speakers, I think the state of our health partnerships is strong. So I can say that definitively, that we're willing to get in the room and hash things out together. We've got great private sector health systems that are willing to set aside their business differences, and I think that's one of the biggest lessons learned through the pandemic was that we had health systems that were willing to put the community first. And then we're very lucky to have the veteran services we have in this community too. That's something, whether it's local government or county government trying to refer veterans for their benefits and for veteran services, we're very lucky to have what we have centered here in Sioux Falls. And that becomes a regional discussion too. So many of our state statistics, when you go through the statistical report, there will be disparities of care by rural versus urban. So as City of Sioux Falls, I'm mainly concerned with city limits of Sioux Falls. But a lot of the disparities then stem from Native American reservations or rural access to care. And so that's where I think my key counterpart at the state level, Secretary Magstad, also has some healthcare priorities for the state, whether it's maternal health, sexually transmitted infections. Those are things we can be working on together. But I think we can say definitively today that the state of our health partnerships is strong.
Joe, as I look at these numbers, I'm actually surprised that some of them aren't worse. Like, only 16.8% of adults have a diagnosed depression. Certainly that's higher than that, but 12.3% smoke. I'm surprised by the number of people who say they exercise. Other than apparently Jeff syphilis, we're doing pretty
That's
well.
our main takeaway, isn't it?
I mean, this is pretty. These numbers are surprisingly good in many ways.
Yeah, and a lot of those, there's always two sides to a story. I'd maybe point to the public health. I don't want to spike the football and declare victory on tobacco, but the fact that we've decreased tobacco use in this country has been a great win. But then conversely, we're seeing vaping going up. So we're alternatives to tobacco. So just when it's kind of like squeezing a balloon, you're solving for one problem, but new things come up. And so I think some of those statistics, yeah, you can tell one side of the story or the other to them, but they continue to be ongoing challenges. But yeah, I think And bringing up the tobacco as a public health intervention in the 1990s, we had a huge tobacco settlement, invested a lot of dollars into that. Now we're in the midst of a huge opioid settlement. So that's going to be, when we talk about the next 10-year strategic plan of public health, how do we allocate those opioid dollars to, if we won some victories, incremental victories against tobacco along the way. Now is our struggle another substance use disorder with opioids going to be the next thing we work on. But yes, I appreciate there's a positive spin on some of these numbers, and some of it too. I think we'll happy to dig deeper with you on some of the citations, and because some things are self-reported, some things are secondary data sources like the Census Bureau or State Department of Health. So sometimes there can be some variability in such numbers, so you might find other sources that say other things, but that'd be another thing we'd be happy to follow up with you, Patrick, on any specific stat.
One other thing, your top 3 health priorities, adolescent mental health. We know anecdotally that access to mental health care for adolescents and children is a challenge. It's very difficult to get services. I'm just wondering what may be happening in that regard to basically get more people. I mean, we don't have enough child psychiatrists. We don't have enough workers in total, from what I understand. So I'm wondering if somebody could address that, and if that's one of their top priorities.
Yes, I think in all of these, when you talk about access to care, I think a lot of times our hospital friends will talk about, we have the beds, we don't have the staff to staff the beds. Like talk about bed availability was a big element during COVID and things like that. But yeah, it's the workforce to actually work within our physical locations. I'd be interested if, Dr. Place, I know you probably hire the most mental health professionals in the community, if you want to speak to that directly.
Yeah, I can. It's a great question. Mental health is just one. If you look at supply of providers, so you pick mental health, we can talk about it. But really across the entire spectrum, there are not enough physicians in America for America. There are not enough psychologists for Americans in America. There's not enough licensed clinical social workers in America for Americans. And so what we're doing is, where we can, with every single educational institution that we have some sort of a relationship with, in other words, we have graduates who come and work with us, we are consistently in dialogue with them on, can you make more? Can we partner more with you as an educational institution? Can we have them come to us? And I know Sanford does the same thing. So what I'm telling you, I don't think Andy would tell you anything different. But unless there's a supply pipeline that can meet the requirements, we're going to have to work through other methodologies. So then from a behavioral health team, whether it's inpatient, partial hospitalization, outpatient clinical, all that sort of thing, what we figured out is we have to find a better way to be more effective with the time that we do have to provide more help for more people in a more effective way. And that's really where we think the tension will lead us to from a innovation or developmental, is how are we more effective in the care that we currently have, rather than putting all our eggs in the basket, we just need more people. So both those things are on the table, but those are at least some of the things that we're doing. And I'll say this, I mean, Joe mentioned a little bit, there's a lot of collaboration. You heard Andy talking about all the things that they're doing in their food pantry. They've had their food pantry for a while, and they opened their doors to us to say, look, this is how we're doing it. We think this is important for the entire community. If you want to learn how to do it, if you want to do it for other people other than we are, come learn about it. And so we did. And most of what we're doing at McKennan, at least, is modeled after what they're doing. So as you read through this report, this isn't fake collaboration. This is real collaboration. This isn't about who's going to see more patients inside our clinics. This is about how do we make a difference in the community so that people don't have to come to our clinics. And that is, I think, how we deal with the demand part of it, eliminate it before there ever is a requirement for it. Otherwise, we're going to spin ourselves into oblivion. Anyway, that's my take on it. Andy, I don't know if you see anything different.
Just one thing to add on that, being a faculty member within the medical school, I will say that the way that we're training our primary care providers, whether that's family medicine, pediatrics, likely internal medicine as well, focusing a much heavier curriculum on psychiatry, mental health, substance use disorders, because oftentimes we are going to be the first place that people come when they get there. And yes, we can say that there's a gap kind of everywhere, but when they come to primary care, they need to be able to be taken care of in that moment, because getting a kiddo to a child psychiatrist may take much longer than we would feel comfortable with. But if we're training our primary care providers to do that work, when often we are fully capable of doing that, I think that's another way that we can address this in the short term until we can just get more. But that is true. The pipeline is too tight. But if we can, at the base level, improve access that way, that would be a win for everybody.
Joe, what's the origin of this report? Where did it come from? And then I know we're digesting what came today, but logistically, when do you start the next one?
Yeah, great question. So this is every 3 years we do a community health assessment, and part of that is our obligation as a federally qualified health clinic. We have certain grant requirements to deliver to the federal government. I know our partners at the health systems as nonprofits have certain requirements to do community health needs assessments, but I think this is a showcasing of this wasn't any of these entities just checking the box for a form for the IRS or for the federal government. This is a truly collaborative effort. And it does take some time. So to your second question there, we will largely be working on digesting this information and getting some working groups together to work on some problem solving. But then about 1.5 years from now, we'll start getting groups together to work on and pull data together, pull Sanford probably leading the way again on surveys, Avera leading the way on organizing some focus groups again, I presume. And so, yeah, the cycle kind of has a tail to it. Mm-hmm. Any other questions? All right. Thank you all for being here. Appreciate it.